Hey, I'm Josh Gordon, and this is Bob Bixby, and we want to talk a little bit about the healthcare reform front this week as we move towards a final vote. What do the numbers look like, and what did we learn?
Well, there's been quite a bit of discussion back and forth with the House amending the Senate bill and sending it back. Basically, it's the same general scenario that we're looking at. Healthcare coverage is expanded, and that's the main accomplishment of the bill is covering another 30 million people or so. That costs a lot of money, and so the question in these bills is how do you pay for that? It's good that Congress and the President have made a commitment to pay for it, not just add it all to the deficit.
Yeah.
So they've been able to do it in a way that does get a score, a deficit reduction score over 10 years, and more importantly, over 20 years. But then, so you have to look at how is that done and how are those savings going to be achieved. But I think that's really the way to look at it. I wouldn't look at this as a deficit reduction plan.
Yeah.
I'd look at it as an expansion of coverage, which is an important goal. And then to look at the various ways of paying for it, and and then you sort of look at make an assessment of risks is how I would look at it in terms of whether the savings will materialize, because everybody concedes that healthcare costs are on an unsustainable path, and if you just add more people to the system without doing healthcare system reform, everybody concedes that that's going to break the bank. There's no question about that. We're already on a path that's going to break the bank. So what we need to do is think about ways to not just pay for the new benefits, but to control costs. When you sort of look at the risks of these things not happening, let's look at the short term first. I mean, you've got some new taxes that will go into effect over the next 10 years. You have savings from the Medicare program, basically changing provider payments, getting less generous, and some would say more realistic payments on Medicare Advantage, for example. Those are going to be tough. I mean, those are tough choices,
and they're tough politically, not necessarily from a policy standpoint.
Yeah, I mean, there'll be that'll be one of the biggest tests, is the political will to follow through on some of these things. And a lot of them don't kick in right away. I mean, it's going to, we sort of go along and we add the system, and then in a few years the taxes begin to kick in. And it's going to be really important to have the political will not to go into retrenchment mode on that. The real key is things that start happening around 2019.
Yeah.
And that's when this new tax on so-called high-cost plans goes into effect. And, for a lot of us budget deficit hawks, that's been a really key part of healthcare reform, because if it works, it's a twofer. It can put downward pressure on healthcare costs, and it raises revenue. So, but to our dismay, that part of the healthcare bill is not doesn't go into effect until 2018.
And that's a change. The original Senate bill, it started at 2013, and then this reconciliation package would push that to 2018.
Right, and there was some political pressure to delay the implementation, and then what's been added in the new provision is a more aggressive indexing of that tax. Now, this gets really technical, and I don't want to get into that, but basically it's in effect for a year or two, and then what they did in the new bill was they indexed it in such a way that it would actually produce more savings more quickly than the way it was in the original Senate bill. So in a way, what you've had here is it sort of delayed pain and then ratcheted up the pain once it goes into effect. And all of that, I think, is worth examining when you talk about the risks. I mean,
because it's just a recipe for politicians to take the easy way out and delay or even cancel it before you get there.
It makes the bill look much better on paper, but people keep talking about the long-term savings, over $1 trillion over the second 10 years. Well, a lot of that has to do with this provision.